Now stand aside, worthy adversary.
'Tis but a scratch.
A scratch? Your arm's off.
No, it isn't.
Well, what's that then?
I've had worse.
How attached are you to your limbs? This may seem like a simple question with a simple answer. For some, however, life seems easier without an arm or leg. The questions that follow are challenging for both patients and doctors. When life and limb literally hang in the balance, coming to a decision is a difficult prospect. Elective amputation is the voluntary removal of body parts through surgery. The permanence of such a procedure calls for careful ethical consideration, but the reasons behind patients requesting it are complex, involving diverse disorders, injuries, and outcomes. People have the right to self-govern and make their own medical decisions. Ethical arguments about autonomy often revolve around a patient's right to refuse care, but do the same principles apply to patients demanding care? Imagine, for a moment, waking up in the morning, opening the blankets, and finding someone else's legs in your bed. Body integrity dysphoria, or BID, is a disorder that causes people to misrecognize their limbs as strange, foreign, or alien. Research has yet to uncover a root cause for the disorder, which means that therapeutic treatment is ineffective. Current studies of BID indicate that victims are not otherwise mentally ill, and that the desire for amputation is constant, with varying levels of intensity. These patients are sane, so the question becomes whether it is ethical for doctors to deny the autonomous desire for amputation. BID patients who are denied amputation have been known to resort to dangerous alternatives such as self-amputation, and report a near 100% satisfaction rate afterwards, provided they survive. So why deny them? One of the most confounding factors involves a general inability of BID sufferers to articulate the why behind their desire for amputation. When asked, most can only give vague descriptions, such as, "I really don't know. I simply want it. I feel where the stump would end up in my thighs and feel a strong desire to live with two thighs blunt." Or, "I just feel like my left leg is too much, that it shouldn't be there, just a stump instead. It does not belong to the true image of my body, but I don't find it repulsive and I don't hate it either." When faced with such vague reassurance, it's easy to see why doctors are so reticent. Non-maleficence is the reason physicians take an oath to do no harm. Doctors are, after all, entrusted with a great deal of power. They might not have superpowers, but Uncle Ben wasn't wrong.
Remember, with great power comes great responsibility.
Closely related is the principle of beneficence, stating that doctors are expected to act in the best interest of patients, to maximize the good. At first glance, amputation violates both of these principles, but this isn't always the case. Consider this case study. A 34-year-old soldier had a right lower extremity injury in a mortar attack, resulting in severe sciatic mononeuropathy. He was initially unable to feel or move the foot, and despite a technically successful surgery and good adherence to physical therapy, 6-month and 1-year post-operative assessment showed no change in strength and continued absence of voluntary motor units on EMG. Prior to his injury, the patient was a competitive distance runner, having completed multiple marathons. Since his injury, he had been unable to run, despite the use of an adaptive ankle-foot orthotic, or AFO. He expressed interest in elective below-the-knee amputation and prosthetic replacement. He was frustrated that his extremity, while intact and, with the AFO, capable of ambulation, was to him functionally useless, preventing almost all of the activities that defined his life. His injury left him functionally impaired, precluding his desired lifestyle, but intact enough to prompt uncertainty about the treatment he desired. Peripheral nerve injuries are a great case study for elective amputation. Beneficence demands that this soldier's doctors amputate. His quality of life stands to improve, as he eventually can learn to use a prosthetic to return to his desired lifestyle. Non-maleficence, on the other hand, makes these doctors hesitate. Amputation is not a simple procedure. Aside from the physical risks, Dr. John H. Flint, an upper extremity orthopedic surgeon with experience in amputation, shares this hesitation, stating,
and that's the scary part of it, right? Is that there's the technical part of putting in and doing the surgery appropriately for the right person, but then there's just all this big black box of the human in which it's done, and that is a wild card every time.
How then can physicians ever come to a decision? To protect patients, physicians follow algorithms that outline a treatment path that must be followed before amputation could be considered. Dr. Flint uses such algorithms almost daily and had this to say.
Or the algorithm that is set up is primarily to guide physicians to make good decisions, and to make sure that you have exhausted other conservative measures that perhaps have fallen by the wayside. You know, the patient is very distraught. It's an emotional decision, and they want to fast track to something. They've made a decision regarding their body, and they want to move directly to that. So I think the algorithm is helpful to just pause, take the emotion out of it a little bit.
The final pillar to consider is justice, doing right by the patient and the world. 2,300 years ago, Aristotle wrote, "Equals should be treated equally, and unequals, unequally." In speaking about amputation, we must also consider what comes after, prosthetic replacement. Prosthetic technology has improved rapidly in recent years, so how does the conversation around elective amputation change as these technologies continue to advance?
Yeah, I think it broadens the application for amputation, or again, a wider, higher percentage of patients that request amputation or need amputation become verifiable candidates. Because obviously losing a limb is function that can be lost for forever. And if you say, well, you can lose the kind of natural function of your limb, and then through prosthetics and robotics and the combination of those things, have a limb that actually functions fairly normally, not going to be normal as it once was, but can help you with the activities of daily living and the other things that we study in detail as far.
Is this true for everyone? What if you live under the poverty line? What if the latest and greatest isn't covered by your insurance? What if you live in a less developed part of the world? These are the types of questions that we will have to face as we move into the future of limb replacement. So, how attached are you to your limbs? Hopefully, now you understand why some people prefer to commit to their Luke Skywalker cosplay more than others. The ethics behind leaving an arm or a leg behind can be difficult to navigate, but with a little thought, we might just arrive on the other side intact.